Hello everyone, and welcome to today's presentation. I'm Dr. Asim Hussein, and I'm excited to share with you insights on Wallenberg syndrome, also known as lateral medullary syndrome. In this session, we'll explore what this condition is, its causes, and the key risk factors involved. We'll also look into how it affects the brainstem and discuss some important clinical considerations. So let's get started and delve into this fascinating topic. Lateral medullary syndrome, also known as Wallenberg syndrome, has some distinctive clinical features. One key point is the crossed sensory pattern we see, loss of pain and temperature sensation on the same side of the face, which is the ipsilateral face, and on the opposite side of the body, the contralateral side. This pattern reflects the way the sensory pathways are organized in the brainstem. Patients often experience vertigo, nausea, vomiting, and nystagmus, which are signs of vestibular system involvement. This explains why they might feel dizzy or off balance. We also see bulbar symptoms like difficulty swallowing, hoarseness, and slurred speech, which result from damage to the nucleus ambigus, a nucleus involved in controlling muscles of the palate, pharynx, and larynx. Autonomic dysfunction can occur too, leading to ipsilateral Horner syndrome. So, ptosis, meiosis, and anhidrosis on the same side, and sometimes hiccups due to disruption of autonomic pathways. Cerebellar involvement is another aspect, causing ipsilateral ataxia, which affects coordination and balance on the same side as the lesion. All these features tie together to give us a characteristic picture of lateral medullary syndrome, highlighting how the lesion impacts multiple systems: sensory, vestibular, bulbar, autonomic, and cerebellar functions. Diagnosis is mainly clinical, meaning we rely heavily on the patient's symptoms and physical exam findings. To confirm the diagnosis, we typically use MRI, specifically diffusion-weighted imaging, which helps us see the areas of ischemia or infarction in the brain. This imaging is crucial for accurate diagnosis and guiding treatment. When it comes to acute management, if the patient presents within 4.5 hours of symptom onset, thrombolytic therapy with TPA can be administered. This medication helps dissolve the clot and restore blood flow. After this initial treatment, the focus shifts to secondary stroke prevention, things like controlling risk factors, and rehabilitation to help regain lost functions. Most patients with lateral medullary syndrome tend to have a favorable prognosis.